Hello, everyone. I'm Dan Toner. It is time for health insurance, the annual renewal for the Magone Company health plan. This actually recording will be good for any new hires, Michelle, during the year too. So we're here to talk about the upcoming renewal, which is every August. So usually in July, we'll move forward and offer plans. Nick and I and Michelle usually work together every June, July, check out the market. So we're happy to announce we're going to move to Aetna for a lot of different reasons, which we're going to go over in a minute. This 25-page memo, you'll get a copy of 3 attachments from Michelle if you're a new hire or for everyone now during open enrollment. The first is a 25-page kit just talking about everything we're offering. The second attachment is going to be proof that we have a Section 125 premium only plan. That means your health insurance deductions, if anything, are going to be taken out pre-tax from your payroll. And then the last is employee notices, things like Medicare notices, GINA laws, all sorts of HIPAA laws, in special enrollments, USERA, you can see on my screen. Included in that is the health insurance exchange and CHIP notices, the Children's Health Insurance Program. So these are annual notices that are handed out by employers every year. Okay, so back to the handout with the memo. I'll go quickly. You need to work 30 or more hours, be a W-2 employee. 1099s are not eligible. You need to be a W-2 employee working 30 hours or more. There's a 90-day waiting period for a new hire. Sometime in the first month and a half, if you're a new hire, you'll get a link from my team as the broker saying, welcome aboard. And we have a portal we're going to talk about on how to easily make your elections. If you waive, you can't come on until you have a qualifying event. These are examples of qualifying events. Then you can come on immediately. Otherwise, you got to wait until next renewal if you waive. So pretty excited. There's 2 different Aetna plans. The 1500 is the base plan where you will pay 0 for a single. Nick made it pretty clear he wants a plan that the employees pay nothing for. And there's a buy-up plan. So we're going to talk about that. Why we're changing to dental, I'm going to get when we get to the dental, but basically the rates are very similar, if not a couple of bucks cheaper for single rate, for example, for Aetna than Blue Cross, but you're getting $1,000 more maximum. So I'm going to talk about that in a minute. Aetna, very similar to Horizon, but we think the Aetna Vision network's a little bigger than Davis Vision. So we figured let's do one carrier for everybody that makes life easy. And a brand new benefit, Magone is now giving you $50,000 of life insurance. So everyone working full time, regardless if you on medical, dental, or vision, you're going to get $50,000 of life insurance from the principal. And you'll have the ability to buy up to $300,000 on your own, called a voluntary buy-up term life. A couple things on the health plan. This I will dive into. The base plan, by the way, this is a better plan than Horizon. A few different reasons. Number one, all the Aetna plans are national. So New York access, Pennsylvania access, Connecticut, California. You don't need an emergency to go out of the state of New Jersey. Super difference between the Horizon, which was New Jersey only. Number two, and I bullet pointed it down here just so you can see it in writing. You don't have tier 1 and tier 2. It's just a simple, any Aetna doctor that's accepting the choice 2, that's their largest network. There's a flyer in here to talk about how to look up your doctor. Any provider accepting the Aetna choice 2, you pay 1 copay. So 25 for primary, 75 for specialist. At the pharmacy, anywhere from $3 to $10 for generic. That was less than you're currently paying. And you have a $45 or $75 copay for preferred and non-preferred name brand. That was 50% after a $250 deductible with Horizon. So you're getting a better prescription. In terms of things like hospitals, surgeries, MRIs, like imaging, you have a $1,500 deductible, which was going to be, you had an $1,800 deductible today with Horizon. They were lowering it to 15. So we basically gave the Aetna 1,500. But you'll notice a lot of zeros for hospitals, 0 after deductible, surgery, 0 after deductible, MRI, 0 after deductible. So once you meet your 1,500, you're literally done for the rest of the calendar year. That's pretty cool. considering that with Blue Cross, you had an $1,800 deductible and then $500 a day at the hospital, $250 for every surgery, $100 for every MRI. So this is all across the board a better plan with a bigger network. So that's one of the reasons why we're going to move forward with that now. We're also offering a buy-up plan, and you'll on our portal, you'll be able to look and see. Let me click the option 2 to see what the cost difference is. Very minimal for those that think they want better coverage, but lower hospital and surgery deductible, lower doctor copays, lower pharmacy copays. So some of you may feel very like base one is fine. I don't need to buy up. But for some of you, a couple different things. Urgent care centers are lower. The emergency room is a straight copay. It's not part of the deductible like Horizon or the base plan from Aetna. And MRIs are the deductible waived as opposed to part of the deductible like on the base plan, like Horizon handled it. So a couple different features on the buy-up plan. Okay. When you get your Aetna member ID, you'll log into the Aetna site. You don't need to log in to look up doctors. There's a little screenshot here of how to do it. You will be looking at the point of service, not the open access, the POS. This is how you look up your docs. Okay. Aetna does have take the guesswork out of finding a provider document, quality and effective doctors. So there's a new feature that they're offering. Take a peek. Moving into the dental. Again, we're nothing wrong with the Horizon plan, but for very similar premiums, we're able to get a $2,500 maximum as opposed to a $1,500. So let me repeat. When you go for diagnostic tests and x-rays, it's 100% covered by the carrier. You pay zero. They pay out. Whatever they pay out went to a $1,500 maximum. That's exhausting on July 31st, and you're getting a fresh $2,500 from August 1 to December 31st. Calendar year, when you wake up January 1, a new $2,500. That amount is for every person you enroll. That's not a family. It's just a per person enrolled amount. So why not? It's a good plan, and Aetna has a huge network. And on that find a doctor search, you can just click the dental and look up their PPO network. Okay. And here's a benefit summary with a little bit more details. On the vision, vision is not covered under medical unless you have a condition like glaucoma, like a health condition, or you're in an accident and you're in the hospital and something's wrong with your eye. Outside of that, if you're looking for routine, like get your eyes checked once a year, reimbursement for lenses or frames, you need a vision plan. Those are not covered under medical. We're going to move forward with that now because basically similar premiums and similar plan design to Horizon. However, the Aetna network may be a little bit bigger than the Davis Vision. Horizon didn't have a network, so they rented. Aetna has their own. So this is an example of what you'll pay once a year. You can go to get your eyes checked, get your lenses reimbursed. You'll have a copay to the doctor, a copay for lenses, and you're basically getting cash, $130 plus a percentage off. Okay. That's a little example of the benefits. Here's the life insurance, a couple of different things. The company is giving you $50,000. When you get to the portal, it says you're automatically enrolled. We will enroll everyone for new hires and during open enrollment. This is a little example about the buy-up. Okay, there's $100,000 guarantee. I'm going to get to that. There's a little summary that just talks about the guarantee. Everybody's getting the $50,000. This is the employer paid. And here's the buy-up. You could buy a maximum of $300,000, but 100 is guaranteed. So what does that mean? 50 is given you by the company. So if you apply for 300,000, they're going to guarantee you get at least 100. They're going to send you an evidence of insurability, EOI email saying you got to answer yes or no health questions. If you're denied, you at least get the 100. That's what the guarantee means. You lose the guarantee if you waive. So anybody can waive off the voluntary life insurance. And in 6 months, 3 years from now, in the future, if you want to enroll, you have to fill out an EOI for any amount. So take advantage of the guarantee is what basically principal is saying. Okay. Towards the rest of the flyer, how you enroll, super important. This is my benefit link. This is my software. You can always ask my team, my contacts in the back. We're going to get to that in a second as I wrap up. But This is an example that when you log in, you create an account, you update your profile, you add your dependents, you're going to get to step 4. All the benefits are on one page. You will have to hit the select button 4 times to make an election or a waiver and then proceed to next. It won't let you finish unless you've made a selection. You can click the compare button to see the side by side, the info button to launch the full SBC for that plan, the benefit summary. Click select to actually start, and you could see enroll, and you'll make your election for which plan you want, the base or the buy-up, or you click the waiver button and then move to the dental voluntary life. On the voluntary life, there's a drop down. You can decline, but there's a drop down to say how much does it cost for 10,000, 20,000. It's in increments of 10 all the way up to 300. And you'll notice once you hit more than 100,000, there's a warning that says EOI is needed, just to remind you that you're going to be getting something from principal. And it's an email that comes to you from principal. Okay. Please make sure you go through step 7 and sign. Super important. There's a next button and you'll see congratulations. If you haven't got the congratulations on step 8, you did not finish. Please make sure you finish. And then Michelle and I take a peek at that, and then we send the information to the carriers. Okay. This is the contact information for Aetna principal. This is my team. Amanda is my right hand, and Leslie helps people come on and off policies during the year, and that's me. And a couple of different programs that Aetna's offering. Their Engage health programs, all the different things. There's the Smart Compare Doctor Search, Minute Clinic. They're owned by CVS, so there's lots of different perks to go to a CVS place where they're actually giving you money for every 3 months you shop at CVS. So they're giving you $100 a year to shop at CVS. So take a peek and make sure you take some time at some of their discount programs and health programs and telemedicine and all that sort of stuff. And that's it. That's all I had. So again, you have my contact information on the last page. Happy open enrollment. Welcome aboard if you're a new hire. Have a great day.